So where are you located? Are you in
I'm in Cal.
Calgary?
Yeah.
Yeah. Yeah. And how are things in Calgary today?
I'm good, I think. Like this week, the weather, because I was actually a bunch of people from across the country came in for a incident management
Okay.
policy lab that Healthcare Excellence Canada was hosting. So they chose to come to Calgary this time, which usually we go to either east or west. And I was bragging to a bunch of people earlier in the week because like everything was melting. It was super nice out and like in Toronto and like out east, it was cold and crappy.
Mm-hmm.
Like, oh, you're gonna get the nice weather. And then like I did a pre-meeting downtown, and when I was walking into the meeting, like so most of the people would have been just sort of arriving at the time. Walking into the meeting, it's super nice and sunny and just, like don't do my jacket up, walking around kind of thing. And then coming out, it was windy and the wind chill was like, oh crap, it's really cold. And so then the last few days have been like, we had a fog warning on Wednesday morning. I was just
Yeah.
bragging
March is
about the
always
weather to
so,
everybody. Yeah.
yeah, everybody's over it by March,
Yeah.
hey?
I haven't gone outside. It looks like there's clear sky right now. And it's not
Nice.
windy, at least from what I can tell. There's
Nice.
a few things that
Yeah,
that make the difference right now.
there's light at the end of the tunnel, I think, coming
Mhm.
soon. So thank you for joining me today to do this because, like I said, this is number four, and every experience teaches me something different, helps me improve. I have different like rituals and things that I have to do now. I got a giant set of headphones that are like as big as I don't know
Yeah.
what, like the biggest earmuffs you've ever seen. I don't know if that's going to be any different than my AirPods, but next time I'm going to try my AirPods and see if there's any
Yeah.
difference with that.
Yeah.
Yeah, but what I've really come to learn in the past few episodes that I've done is initially I started this because I was like, I'm going to highlight improvement work like initiatives. I'm going to highlight the things that people are doing. And then what I've realized is what's more interesting are the people that are doing the work and what they have to do to move things forward. And so when I started drifting into that idea, I was like, oh, Teri, that's the person I have to talk to because you're one of the most inspirational change agents I've ever seen in healthcare. And you're not a formal leader, you're not a CEO, you're not, anyone with a formal role in the system, and yet you've been able to do so much. So I'm so excited to have a conversation with you to learn about your journey. So
Yeah.
tell me a bit about you, like where you grew up, how you
Yeah.
got on this path.
Yeah. So grew up in a really small town, well, outside of a really small town on a farm. There's five kids in my family and lots of cousins and stuff around. So sort of that small town experience where we, yeah, like roaming on the farm and
Hmm.
sports was really the pastime that all of us did. So pretty much my whole childhood was either going to tournaments for myself or one of my siblings, which was always fun. I think there's always enough sort of other kids and distractions, and I think that was a um like sort of formed
Hmm.
we all are through learning through sports. And after school, did 1 year in Calgary. So the small town I grew up in Zachary, it's about an hour outside of Calgary.
Okay.
Decided because I was fairly indecisive and ended up go applying for the University of Calgary, did 1 year in Calgary and then decided I wanted to be further away from home. I just kind of felt like I wanted to have a more unique experience and so applied for the University of British Columbia and then did 1 year in UBC and then went on exchange. So I studied in Mexico for a year. Um, so but through all of that, really didn't know what I was wanting to do. I was
Yeah.
sort of initially thinking, oh, I'll just take business because it's um, applies in so many different industries and stuff. So I wasn't really picking a specific field. Um, and then when I went to BC, ended up in a program called Global Resource Systems, and then that sort of led to that was why I went on exchange, led to some interest in more international development and really wanting to figure out ways to have a broader impact in that sort of desire to to do that.
Change the world.
Yeah, but
Hmm.
and I was living in res with my cousin who was best friend, and she went into nursing. And I was like, nope, I am not going into healthcare. Like, it's a nightmare.
I don't want to do anything to do with
Yes,
that.
it's way too scary. And like, I had a couple of experiences in hospitals visiting people, and I was like passing out almost.
Yeah.
Like, I was very much not interested,
Mm.
very much not thinking that healthcare was going to be part of my career. Um, Graduated with Bachelor of Science and then did an internship in Ecuador, working with the team doing disaster management,
Mhm.
and got really interested in that. And so then when I came home after the internship, went into a master's program and got a master's in disaster and emergency management, which then led to doing emergency response planning in the energy industry here in Calgary. So I also got exposed to the health and
Yeah.
safety culture and like incident management in the energy industry, and that's where I was working at the time of Greg's death. And
Okay.
so that's also, I think, sort of bled into the approach that we took in learning
Yeah.
Greg's experience, like learning from Greg's death, trying to get an understanding of the healthcare system, trying to get an understanding of how we could help support preventing it from happening again. And then we went through the investigation and eventually made the choice to create the film. And at that time, decided to create the organization Greg's Wings Projects, and have been working in that role for 8 years now,
Okay.
um, with using the film and having lots of conversations about the need for change and improvement in healthcare, and really trying to support that, probably with the most fundamental goal of safer care in
Hmm.
healthcare. But that on its own requires so many different
Hmm.
changes, and has been sort of something that's been very hard for any system to really address effectively, I think. And so I think it takes a different approach and different ways of thinking before and different systems and processes in place in order to really move that needle, which has been interesting and challenging. Um, and if we can have any kind of impact by sharing Greg's story and what we've learned by sharing the film, that's for now at least a place
Yeah.
where it's rewarding and the challenge is interesting, and
Yeah.
why we keep sharing the film and doing what we're doing so far.
So before we talk about Greg's death, let's talk about Greg's life. What was he like as a brother? What was he interested in? Do you have any like favorite memories of Greg?
Yeah, Greg is somebody, well, to start with, he was super intelligent.
Hmm.
He was a mechanical engineer, was also had his own company that he was sort of built off the side of his desk, that was focusing on water treatment in the oil and gas industry, trying to recover some of the wastewater that gets dumped down wells, and being able to use it in agriculture, which has been the family business for forever. Um, he loved to challenge himself. Um, Both probably wanted to have an impact and probably more impact on people. Like, he had really strong relationships, and people after his death shared how Greg made them feel seen and was such a good listener and was always like had that deep engagement in relationships with people. Um, he loved a challenge and liked to challenge himself physically as well. He was sort of a workhorse in any sport that he played. He loved baseball, even played after university with Medicine Hat Mustangs, and was a great teammate too.
Yeah.
Like, he was just somebody that sort of those relationships and his energy and wanting to like do his best and challenge himself, but also challenged others to do the same. But led from example. He wasn't somebody who sat back and told people what they should
Yeah.
do. Yeah,
Yeah.
like, he to encourage them to challenge themselves. Um, and I think he was also somebody who loved to like talk through things. Like, I remember having long debates and conversations on when driving around places, because
Hmm.
inevitably living rural means you end up driving a lot.
Mm-hmm.
And yeah, those kinds of road trips. And he was also really good at like focusing in on really what mattered and sort of cutting through the noise too. Like I remember times where I would be complaining about all of these things and he would be able to like, yeah,
Get
but
to the heart
like,
of
yeah,
it.
that doesn't like,
Yeah.
bunch of that doesn't matter. Like focus on what actually matters.
Yeah.
And so yeah, he was just a great human being, somebody super supportive. Um, very lucky to have had him as a brother. Feel like the next generation is missing out in having
Uh-huh.
uncle or
Mm-hmm.
yeah.
Yeah. But it sounds like he sort of had the qualities that you have to use today for the work that you do, right? Like building relationships and getting to the heart of things and motivating other people and role modeling. Like those are all sort of lessons and gifts that he left you with. So what year did he start feeling sick?
So the first time anything was flagged was in the summer of 2011. He was also a private pilot. He had gone to get his pilot's license. My dad has always had, my dad has a Cessna, a little
Yeah, my
plane.
dad does too. Or
Yeah.
did. Yeah.
Yeah.
Mhm.
Yeah. So Greg went and got his private pilot's license. So as part of that, you have to do a physical. And so he, at one of those physicals, flagged what got labeled as a thickening of the epididymis. And they did a few tests after that, but nothing came back like outside of range or a major
Okay.
concern. So nothing happened after that first test. He started having back pain um, almost a year later, not quite a year, but and then went in for back pain.
Okay.
So that would have been early in 2012. Um, And that's when sort of the real focus on trying to get a diagnosis started, and was very disconnected. Like
Mhm.
he went because the physician that he went to for his private pilot's license, he wasn't technically rostered or a patient of that clinic. It's kind of how it works with a private pilot's license. There's only certain physicians who are have the right license or certification to be able to do those Department of Transportation exams. So he went to him for that, had a good relationship with him, and actually went back to him sort of in that same time frame when he's started having back pain, I think, because he had a rash on his foot. And that doctor made a referral to a general surgeon because he must have seen in his notes that there was this thickening of the epididymis
Uh-huh.
on it and decided they needed to do some more investigation. So that was another like pathway that they were trying to figure out a diagnosis. But the back pain, he went to a walk-in clinic that was on his way to work. And so that started a separate channel. And that's one
Mhm.
of the things that we advocate for now is that continuity of information
Yeah.
and the information to follow the patient through the system because the walk-in clinic didn't have that information around the thickening of the epididymis and that investigation that was happening. And we believe that there's a lot higher chance that the connection to testicular cancer would have been made at that time if that the
Mhm.
pain and that other information was in the same place or accessible to the team. So they started doing an investigation on the back pain, which you can imagine back pain
Right.
could have a whole number of different reasons and like just the delays between tests and referrals to specialists. There's multiple different referrals that weren't acted on in a time frame that would have been ideal, and so a lot of time passed. He did eventually get in to see a urologist. The urologist did surgery on the Wednesday. Greg was still having a lot of pain and swelling, went to the emergency room on Friday. They sent him home, and he passed away at my parents' home on Saturday. So it was a lot of sort of delays building up to the last week of his life and just really disconnected care.
Yeah, the system just completely
Somebody,
failed him.
yeah,
Yeah.
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 And I mean, we share the film we've shared it hundreds of times, and we hear lots of people's experiences that pieces of the film and Greg's experience resonate because they've seen it with other family members. And one of the things for me too, in learning more about the healthcare system and thinking about who Greg was and how he had so many strengths in so many different areas, and then thinking about other patients and like if Greg couldn't figure it out and couldn't
Yeah,
navigate his way
advocate.
through, it's very scary to me, that we need to have a system that is meeting the needs of all patients and set up to address all of the complicated and unique needs that people have. Because if we can't address the needs of somebody like Greg, there's we've got some potentially serious issues, and there's just so much room for improvement.
Yeah.
That any way we can help support change, we're happy to do that.
Yeah. I saw the film. I was trying to think of when it was. I feel like it was probably about 10 years ago. And it is burned into my brain. Like there are so many, well, first of all, there wasn't a dry eye in the house, I think, after we watched it at Broadway Theater. I remember the scene where the fax didn't go through or the fax got missed or something with the fax machine. And even this week, I knew I was talking to you and I have a referral for a test. And I was like, I better phone and see if that referral went through because even with electronic referrals now, they don't go through. And then 6 months later, you're like, oh, I wonder what's going on with that test. And they're like, oh, we didn't have you on the list. And so, I'm asking them to find out if they for sure have the referral. And I do that with my parents and tell all my friends because that fax machine I think about it all the time. And then the power of the storytelling and how that can really change conversations. So the idea of doing a movie about Greg's experience, how did you come up with that idea to share his story?
Yeah, and I think when we made the decision to do it, we had no idea what we were actually getting into. Well, and because the initial idea of it, so there was an investigation that was done, and Ward Flemons, who's a respirologist here in Calgary, but he's also trained and does lots of work in quality and patient safety, and he was on faculty at the Cummings School of Medicine, so the University of Calgary Medical School. So we got to know Ward really well and trust him, have a lot of respect for him through the investigation, and that process itself was extremely impactful and important for our family. And so after a couple of years of sharing what we learned through the investigation, the reports that were made, Ward came to us to ask if he could share Greg's story with the medical students when he was teaching, in particular, importance of teamwork and patient safety. And so we liked that idea. I thought that if we're trying to have an impact, being able to share Greg's story early on for in the training of the next generation might be one way to have an impact. So sort of just gave the go ahead. And I think in the beginning, we sort of thought it'd be sort of medical education video clips that we were creating that could be used in a classroom.
Yeah. Yeah. Some AV
But
studio at the bottom
yes,
of the university.
yes. But when Ward reached out, he was introduced to Andrew Reggett and Becky Shaw, who ended up writing the script for us. And Andrew and Becky had worked a number of times with Dean Bennett, who ended up directing. And Dean was the director of the Heartland TV show that's on CBC at the time.
Okay.
And so once we had that team, that core of the team pulled together, we were able to recruit the professional cast and crew that helped us pull off the quality of the film that we have. And I'm so grateful to have the film. And even like at one point, we sort of thought we would kind of do it like a 1 hour documentary style. I'm so glad we ended up with the half an hour just dramatization of what Greg's story was. Because like if we would have embedded a bunch of like commentary in between, that could go out of date or be
Sure.
missed for some reason. Whereas the story is the reality of what happened. There's a lot to learn from it. And I think the writing in the script aligns a lot with what we wanted the message to be. We don't, I mean, if there's a villain in the film, it's probably the fax machine. We're not pointing fingers at individuals. You can see multiple points in the film where
Yeah.
people could have made a difference, but the like storyline is not sort of building to pointing fingers at a villain that caused Greg's death. It's not the
Yeah.
reality, and it's not what we want the messages of the film to be. We want the impact of the film to be people recognizing that there's gaps in our system, and we need to be thinking about things that'll change the system, so it's better for patients, but better for the workforce too.
Yeah, and watching it, thinking about, well, that could have been my family member, that could have been me, you could see how easily that stuff happens because you're always part of a disconnected system as well. But then it really spoke to me as a nurse because I remember every shift having those near misses or, the med error, or it felt like we were getting by the skin of our teeth because the system was so flawed that no matter what you did or how hard you tried or the list that you made and the things you wrote on your hand, that you're going to miss something and something really bad was going to happen, and it's a terrible way to feel at your workplace. I left acute care very shortly after I started because all I could see was that every day it was so stressful.
Yeah,
Yeah.
no, like I can imagine why people start to sort of either leave
Yep.
or start to sort of shut down. You kind of have to accept that this is
Things are
the
going to
system
happen.
you work on. Like
Yeah.
this, there's always the potential for something to go wrong because we haven't built or designed a system from a true systemic lens. Right now, there's so much that's just accepting that it's a reality that we can't change, which
Right.
I don't think is true. But I think we need to focus on some of those fundamental things that will change the system and create the conditions for safe care.
Mhm.
And really, what we're trying to do is ask for help or build a team or share information effectively. And like all of those things is the fax machine the best technology that's out there in order for us to be able to do that? Like, we
Yeah.
know it's not. But the thing
Um,
is that it requires that collective commitment from a system lens to get rid of it.
yeah, for sure. Yeah. So you created the movie and then, which again I think is so brilliant, you took it on a roadshow. You went to cities all over Canada. I don't know if you
Yeah.
went other places with it, and then you just didn't like put it out there. You had people watch it, and then you had panels and discussions afterwards for people to kind of process it and talk about it. What were those experiences like?
Yeah, I remember when we were just, well, either when we were shooting or in the planning stages of the film, at some point, I think maybe it was for grant money or something, we had to like outline what our distribution plan was going to be. And I remember thinking, okay, we'll be involved directly in sort of that road show, the first sort of like series of screenings of the film. And then we'll maybe set it up so other people can use it, and then we'll just put it online so people can watch it. Um, and I think being in the room and seeing the impact of the film and the impact of the discussion after the film, um, we've never really moved past that phase. We're still
Mhm.
at this point, even we're close to 800 screenings. We still join every screening. And it's partially because we see the emotional impact of the film and the idea of somebody watching it on their own and potentially bringing up some of those emotions without the opportunity to talk through them. And it's also a huge learning opportunity for us and hopefully for everybody involved in the screenings, because the discussion can be so rich and it keeps us too up to date in what's going on and what
Mm.
people are concerned with or frustrated or what they're excited about and what's coming, because it comes up in those discussions after the film as well. So we've learned a lot. We're happy to share what we have learned with audiences when we have the discussions, and hope that some of the things that we point to is what we want to see in the future, or examples that we're seeing now that we want to see spread. Um, that can be part of the impact that the film has. We've met lots of people who are doing great things and are passionate about trying to improve the system, and so we're really grateful for that.
Um, we in Saskatchewan, we have a lot of patient partners with people with lived experience. They call them in other places, that, will often come and give their insights and experiences or share their stories. How have you or has the foundation been involved in working with like the actual healthcare system? Or what percentage would you say that you like working, pushing from outside and working from inside?
Yeah, I mean, I like being able to do both
Mhm.
in some ways, and it depends on the probably the time kind of too. Like there's probably been times where we're more right in the conversations in and we sort of have three priority areas. So those times where we're more embedded in having conversation is if it's one of our priority areas where we think we can actually have an impact by being directly involved with people or leadership in the system. Typically it'd be joining a committee. Um, and we choose to do that if the objectives of the committee align with the objectives of the organization, which is really trying to push for more teamwork and the systems and mindsets to support that. There's access to information. We really do believe that we need that continuity of information in the healthcare system. So pushing for again, there's needs to be a shift in mindset around that in some ways. The sort of privacy and security concerns has been overshadowing the need to effectively share information. There's a lot of assumptions from the outside of the system, I think, and even assumptions within the system are a lack of deep understanding of what the information systems do or don't do. And then the last one is around learning from harm. So even this week, I sit on a group that we were at a policy lab with Healthcare Excellence Canada trying to think through how do we push for improvement and really because for us that the opportunity to learn with Ward and the team that was at the Health Quality Council of Alberta, which is now Health Quality Alberta, that was so critically important for our family to get that better understanding of what happened and is a lot of the reason why we've continued to and can advocate for change in the system is because we had that opportunity to learn more and learn specifically about what happened with Greg and what recommendations could make a difference in the system. And that was really foundational for us to be able to continue to advocate all the way through. So we really believe that that kind of learning and having a just culture in healthcare is so critical. I don't think we'll move the needle on the safety statistics without having all three of those components in place. That learning when things go wrong, having the information systems in place so that we're actually setting people up for success when they're making decisions instead of expecting them to make the right decision every time only with a slice of the information and really recognizing you have to work together and the teamwork from the perspective of who's on the patient's team.
Mm.
Happy and grateful for the more of the conversation around team-based care, but we have to really push so that it's teamwork throughout the system and with the patients and families and teamwork from a patient perspective because you can experience really great teamwork within one organization in the system, but if the patient has to move through different organizations, those gaps in that transition can be a really risky place. So
Yeah.
having that teamwork across and that mindset that it's evolving team that's following the patient is really where we want to push for the
Yeah.
future.
So I can't imagine like, I don't know, maybe it's because I'm almost 50 that I just am like get so frustrated in doing this work. Because you feel like you're trying the same things over and over again, or like you've got to start from scratch when there's a whole system turnover, or people kind of keep wanting to do this command and control approach to system change. And so I can't imagine the frustrations that you felt over all these years trying to change the complex system of healthcare. Like what just frustrates you, or what barriers do you see that you just can't believe you're still fighting them in 2026?
Yeah, I mean, um, there's definitely lots of things that can be frustrating, exactly as
Mhm.
you described. But I think we really do need to have people have that full systems understanding. They need to have the depth of knowledge in their own piece of the system,
Mhm.
but also recognize how that fits into a bigger system. There's a lot of sort of, and I can sort of imagine why too. Like it's the system is so siloed. It's hard to collaborate across
Mhm.
the system. It can be frustrating And so people tend to just focus where they have control.
Mhm.
And I think that only gets us so far. And so, really, also acknowledging that we do need to collaborate effectively across. There's not going to be one organization or one profession that's going to fix the challenges that we have. So, we need to have ways of effectively collaborating and learning from each other and learning from different perspectives. And even like that systems thinking lens, like there was one of the sessions that we were in, I don't know, it was a couple years ago, probably now. And there was different perspectives in the room, and we kept talking about the system. And for some reason, at some point, somebody's like, okay, well, when we're talking about the system, what do we actually mean? Like when they're saying the system, they're probably meaning the ministry or the bureaucracy or
Yeah, yeah, or the organizational
Alberta
structure.
or something
Yeah.
like some other thing that it's not them, it's the other part.
Mm,
And so even just that part too, like how do we shift that so that everybody has the understanding that they have a role to play,
mm.
and that collaboration both at a micro like patient's care team level and being able to have strong teamwork and all of the systems and process and incentives and mindset in place at that micro level is so critically important. But it's the same. There's some similar principles at a systems level as well. That if we're thinking that we're just going to wait and see what the ministry decides, and we can't do anything, we have no agency to change care because the control sits at the top, like that's a problem too. And if the
Yeah,
top thinks that they understand everything and know all of the issues and will be able to address all of the problems, that's also a problem because they don't.
yeah.
So we need to really have ways of working in place that bring those different perspectives into the conversation where it can influence decisions and deepen the understanding and knowledge of a true like system as well, while recognizing the system is a complex system.
I'm really getting interested in this human learning systems approach where, it's like a vertical learning mechanism. So you learn from the patients that you're working with and you're asking questions like what matters to you, what's important to you, what do you need? And then that's shared with the team. And then that's shared across teams. And then that's shared across the organization. And then that's shared with the province. And then the province kind of reacts to that so it's sort of this like vertical integration of learning about what works, what doesn't work, what can we try. And I'm still trying to get my head wrapped around it, what that would look like in healthcare, but it seems to me like it's kind of like a learning infrastructure. But the foundation of the learning happens between the providers and the patients.
Yeah.
But
Yeah.
that's not lost. That's collected and used and grown and shared and moved up the chain. And then policies and decisions and funding is moved back down the chain. And I just think there's really interesting opportunity with that framework.
No, I think we do need to recognize and try some things and see how we can better integrate across like that. One of the sort of concepts that I think is kind of similar to what you're touching on is it's this concept of collective storytelling with the goal of like collective knowledge. And I co-chair an organization called Networked Health. And one of the things that I see with that group is that perspectives are very diverse. We have lots of different people with experience in like physicians and nurses and members of the public and members from the ministries and technology vendors and lawyers and whole different groups and physicians in lots of different roles in different parts of the country. And so the focus is around like optimizing our information systems. But when people talk about the impact of the sort of disconnected information systems on them and their perspective,
Mhm.
when we have the opportunity to learn from all of those different perspectives, it really deepens our understanding of the issues that exist in the system. And
Mhm.
so having that opportunity just to even hear like what it's like for a OBGYN in northern BC. And if he
Mhm.
can't have full access to the information, like he's making decisions on whether or not he's flying, like getting a helicopter to fly somebody in or out because he's not confident that he has all of the
Yeah.
information to make like, and so like there's so much impact of that both on him, on the patient, on the system and the resources that we're using. Like all of those things, being able to share like stories and experience from different perspectives, I just see it as, and that's probably partially what we do when we're sharing the film and having all these conversations with different audiences. It's an opportunity for us to deepen our knowledge, but it's because people are sharing their experience from lots of different perspectives or asking questions that sort of open up. And so I really think that if we're trying to focus on the system change that needs to occur, not just the like quick wins kind of, what's your one thing that you would change in the system, like really talking about how do we actually create the conditions for safe care, we have to have those diverse perspectives as part of the room. And I think it shifts too, so that you have that collective commitment and push towards common goals instead of it being like every organization that's representing a hospital or representing a
silo
knocks on the door of the ministry saying this is what you need to do for us. But if it's a collective group
effort,
and the deep understanding that can say these are the things that we want and we're working towards in our system, it's just a different way of approaching it. And I think it, for us, it's been super valuable and interesting. And I see some of the experts and people who have spent their whole careers in this space, like focusing on some of these issues, really excited about some of the momentum and movement that we've been able to cause by taking this approach that they haven't experienced doing things in a traditional way.
Yeah, because another theme that keeps coming up in these podcasts is like fragmentation, silos. And I think we're talking a lot about like organizational or professional silos. But I think we also silo ourselves as individuals, right? And we don't hear other perspectives very often. We work in our little area or we're focused on our work. And then so breaking of those silos actually starts with like individuals connecting and sharing and learning from each other.
Yeah, for sure.
Yeah.
And like there's a group that has been working in some of this that really focuses on mental health and youth, and like some of those areas, if you don't touch it, if you're not like, it can be scary to try and interact with some, it can be like you don't want to ask the wrong question or expose that you don't have that depth of knowledge. But if we can create the spaces and opportunities to share and learn, like some of our meetings, sometimes I get concerned. Some of our meetings can be really quiet. Like people aren't really speaking up and asking questions. But then when we get the feedback from the group as a whole, everybody's finding it really valuable. So I think people are really just soaking in the knowledge that's being shared and appreciative of the opportunity to learn from some passionate people who have lots of expertise. And it's potentially a different area than they typically would like go to, I don't know, their professional association conference once a year. But we need to have these additional opportunities to collectively learn as well.
That sounds like a super interesting initiative. I'm going to post information about that in the show notes for sure.
Yeah.
What else is giving you hope these days?
I mean, people quite often do.
Okay.
Right? Like you can get frustrated by the like conditions in the system. But the interactions with students can do it. And meeting people that have great ideas or have been working on things that are really passionate and wanting to push some of that forward, that gives us hope too. Last year, I joined the board of the Patient Revolution. And Victor Montori, one of the things that he talks about in his work is that it's like generational change, some of the stuff that we want. And I remember hearing that and being like, really? Like, we have to wait a whole generation before we can actually see some of these changes. But there's definitely things that don't need to be generational change, but some of the shift in mindset and the like thinking about healthcare differently and trying to get away from that sort of feeling like when you're sharing the experience of being a nurse. And I think a lot of patients too can feel that like, oh, I was lucky in this experience. And we just sort of like think that's normal in healthcare. Like, why are you accepting that safe care or a good experience in healthcare means you're lucky? Like we need to have the systems designed so that we're consistent and safe as default, not.
Well, and it's also like a question of safety for the provider, like not, but like safety that you'll keep your license, safety that you'll keep your job, safety that you'll, be able to provide good care. Like that feeling of insecurity and vulnerability is not an enticing profession to sign up for. And those are the things that we don't have conversations about in retention and recruitment.
Yeah. Yeah. No, and that's probably one of the places where I'd be the most scared is that we're losing really good, well-intentioned people who
Yeah.
want to care in the system because they get into the system and then the system doesn't support them
Yep.
in being able to deliver the kind of care. And so they're choosing not to stay. We need to create the system so that those people can have rewarding careers, um, because not everybody makes that choice. I have a huge amount of respect, like I was saying earlier, that I knew very, like, I never even really considered a career in healthcare because it scared me.
Yeah.
I knew it would be really hard, and I wasn't willing to make that choice. And so I have a huge amount of respect for
Yeah.
people
Me
who
too.
will. And if we can support the change that makes it, I mean, it needs to be better for patients, but we're not gonna, like, you can't, it's not either or. It has to
Yep.
be both.
Yeah.
We have to be supporting the workforce in order
Yeah.
to have better care for patients.
And can you tell me a bit about Renew 72 and how Greg's story made it to the Parliament building in Ottawa recently? That was
So that,
exciting.
yeah, yeah. So that's connected to that work with networked health. So that same collective group, and learning as that group. I mean, Greg's story does such a good job of sort of exposing some of the
Mhm.
gaps in the system, and so I think that is why it gets referenced in some of those places, like when they were retabled Bill S5, um, which is version 2.0 of the Connected Care for Canadians Act, which was Bill C-72. So that's why the
Okay.
website's called Renew 72, is because we were pushing to get Bill C-72 retabled because it just like died because of the change in government.
Oh, yeah. Mhm.
So it had to be retabled. And so we created this website. It's connected and supported and coordinated by Networked Health, which is that collective group focusing on improving health information. But we stood up a separate website. People can sign up either as individuals or organizations to support the Connected Care for Canadians Act. And so it's not just us, it's this whole collective. But because Greg's story can be such a powerful reason why this is important, that's why his name comes up in the Senate.
I
And
know,
I
but
mean,
that's like a big deal. Like, that's amazing that it's woven in with this bill to help people connect to the heart of what this is about.
so we still have to, it still has to go through the House, but
Okay.
it started in the Senate this time. And yeah, we're just happy to continue to support that work. Like lots of things, it's not perfect, but it's extremely valuable to spark some of the discussion
Yeah.
around how important it is to have information follow the patient through the system.
Well, I have this thought for Mark Carney when he's listening to this podcast that, they've been talking a lot in the last, whatever, 6 months, year about nation building projects and ports and pipelines and modular nuclear reactors. And I'm like, do you know what should be a nation building project? Is a nationwide connected information database where your information, like, because people also move out of province, right? And we've got 15 separate health delivery systems. And, what would that do to keep the workers and the economy going? Because we have healthy people that get timely care in a safe way and reduce lengths of stay and avoid hospital admissions. Like, I feel like that too could be a nation building project. And if you took all the brilliant minds across the country and put them together in the way that they're doing this and expediting things with pipelines and projects like that, like, why couldn't this be one?
Yeah.
So,
No,
Mark, that's an
I
idea.
completely agree. And it was actually something that I thought about in between when the Bill C-72 was tabled compared to when the Bill S5 was tabled. So
Uh-huh.
at the first time, that was previous government before Trump was back in the
Yeah.
US, before all the tariff and that sort of national reaction to it.
Mhm.
I remember thinking like, well, this is interesting because a lot of the conversation with the first bill that I was hearing or maybe listening for was whether or not the provinces were going to react to the federal government putting federal legislation forward related
Yeah.
to something in health and saying sort of stay out of our lane.
Yeah.
Um, and whether or not when it got tabled the second time, the national reaction would be different
Yeah.
because there has been more of a sort of national unity kind of thing. And I mean, historically, Canadians are very proud of their healthcare system. And
Yeah.
so if we can communicate this clearly as being this is something that the whole country should support because it would make our healthcare system stronger. And there's like reports in the fall, I don't remember exactly what the numbers are, but around the economics of having the sort of connected system in the country, it's billions annually in
Oh,
savings
wow.
around having some of that. Like there's so many different angles and different ways that you could sell this as being
Yeah. Yeah.
beneficial for the whole country.
Yeah.
It's a safety issue. It's economically
Where,
that makes sense for innovation. It would be like if you start talking about the opportunity with AI, you have to have strong data to
yeah.
for the AI to learn. And if we don't, if it's all scattered or there's bias in and like all of those things, like we have to have strong information systems to support that. And like if we're saying that the vendors have to build tools that are interoperable, it opens the door for better design and potential
Mhm.
innovation as well, instead of consolidating some of that market share into a few different places. So
Yeah.
there's
Yeah,
lots of
Kai Hai's really
opportunities
leading
that
some good work on this. They've got a vision. And I mean, one of the reasons why I decided to do this podcast is because I listened to Ava Spavero's podcast that she was doing with Kai Hai. And one where, it was so interesting and so fascinating around the opportunities with data. And I was like, well, these are interesting conversations. I'd like to have more of them. So if you could give your advice or your wisdom after doing this for all these years to anybody that's working in the system, pushing for change, what would you tell them?
Um, I think recognizing that change is not something that like is extra work that people have to deal with, that it needs to be sort of built into the way we work, because there's not an endpoint. It's going to be always part of healthcare. It should be because there's always lots of opportunities. So I think that having that mindset around change is important. Ideally, the system would also follow that so that people do have time to be able to spend time on change. It's not something that's extra on top of a full shift. And being able to enable it so that change isn't just done at like change decisions aren't just done at the top. I think thinking through the whole role that everybody has to play, like there's so much and we see this sometimes when we interact with clinics, like you're saying that um, the film can be really sticky. There's like a line in the film around no news is good news. And there's been multiple times where we've shown the film to a clinic and then interact with members of the team at a different point in time. And they say, after seeing the film, we change the process in the clinic so that we don't say that anymore. We make sure that we are covering off so that patients don't fall into crack just because a piece of information didn't come back to us or to them.
Yeah.
And so there's a lot that you can do, either like even down to the micro level of like, this patient looks like they're struggling and recognizing and speaking up, or
Mm,
inviting the family member to be in the room. Like
mhm.
those kinds of changes can make a huge difference in a patient experience, or those kinds of actions can make a huge difference in a patient experience. And it's not system-wide change that needs to happen to enable people to
Yeah.
make those choices.
Yeah.
But there's also this speaking up and supporting some of the system change that we actually need to see as well. And I think having everybody recognize how the role that they can play in supporting some of that kind of change is really important. And the one thing too, I kind of um, reference it super quick around like the quick wins. And like sometimes
Yeah.
in conversations like this, somebody will be like, okay, well, if you had to pick one thing, or if you had a magic wand, like what's the one thing you would do?
Yeah.
And then it'd be like that we stop doing that because we need to recognize that there's some foundational pieces that need to be built into our system in order to make things better. And some of those changes aren't going to fit within an election cycle. Like we need that vision for the system and the commitment that is going to be required over the long term in order to implement some of those changes. And that's probably one of the characteristics that I didn't bring up about Greg, that he was gritty, he was committed, he
Mhm.
willing to do the hard work. And I think that is
What
something
it
that we need
takes.
to, yeah, it's
Yeah.
not that like, oh, well, what can we do to just prove that we're doing something right now? We need to have that longer term commitment. If we only focus on the things that can be done to prove we're working right now, we're going to continue on that hamster wheel where we don't have systemic change that we need. And
Yeah.
I get scared that the more polarized the political systems get, the more likely that you like flip back and forth, right?
Yeah.
That instead of like continuously building on what the last party did, it's like, oh, we can't do any of that because
Yeah.
that's them and this is us. And so we have to take a different approach. And
Yeah.
so that, and just how flawed that is for the kind of
System
ongoing
change.
commitment.
Well, thank you so much, Terry, for taking the time. Like I didn't know Greg, but I can almost imagine what he must have been like in seeing you and the work that you do and the commitment and the love that your family must have had for him to have dedicated your lives to making sure that this doesn't happen to any other family. And so on behalf of everybody who's seen the video, everybody who might see the video, everybody who's been affected by an incident or a near miss, like, thank you so much for the work that you do. It's invaluable for the healthcare system. And we, like, honestly can't thank you enough.
Yeah, thank you for having me. We love having these kinds of conversations. We're always happy to share the film. So,
Yeah.
um,
You have some virtual viewings coming
yeah,
up, right?
we do monthly, totally open to the public live streams of the film that
Okay.
have, right, it's a chat conversation, so it's not the perfect setup for
Yeah.
being able to see the film and have a discussion, but it's one way for people to be able to see it, and to hear from us after the film as well. So on our website, if you just go to
Okay.
gregswings.ca/events, it's there. The schedule is there.
And I'll
And
put it in the show notes as well so people can
yeah,
link on there.
yeah.
Mhm.
Yeah, but definitely we're always open to having conversations with people, and as an organization we're sort of starting to think about what's next. So being able to hear from people and bounce ideas and
Yeah.
hear other people's ideas would be super valuable right now. So yeah, and thank you for the invitation.
Yeah, anytime. And if
The
things
time will
change or
yeah.
if you have new things that come up or whatever, you're always welcome back.
Yeah, no, maybe when we're ready to pitch our next thing, we'll come back and share.
Sure. So, yeah, thanks again.